Thanks, Lorraine. I'm speaking to you from our Psychiatric Intensive Care Unit, PICU. This is a perfect example of where financial investment and a focus on quality come together to deliver better services for our service users and their families. Our investment increased in capacity within PICU has reduced the need for service users to be cared for out of area. That surely is better for them and better for their families. So our quality priorities remain, as always, to provide services that are safe, personalised, accessible and recovery focused. In doing so, we always look to adhere to our Proud to Care values that are to be compassionate, approachable, responsible and excellent. Taken together, our quality priorities and values drive our overall trust vision, which is to be outstanding in all we do and how we do it. So, how did we do in terms of delivering on our quality agenda in 2019 and 2020? Full details are available in our annual report, which we're publishing today, and is available for free download from our website. I am proud to be able to share some of the highlights from each of our quality priority areas with you. Our first quality priority, safe. We have continued to work with partners towards our zero suicide ambition to reduce death by suicide. 84% of our staff received face-to-face suicide awareness training. We strengthened physical health monitoring for our service users. We increased compliance with infection prevention and control audits from 90 to 95%. We refined the falls reduction quality improvement project to reduce falls on older people's wards. We fully embedded the community safety metrics across all teams. We developed and implemented a best practice cybersecurity system. We reduced the number of avoidable transfers between acute ward areas. We also launched the Observe and Act initiative across our inpatient areas, strengthening patient engagement to improve standards. We also implemented our SPA wards accreditation framework to enhance the quality of care on inpatient wards. For our second quality priority, which is personalised, we have co-produced a person-centeredness framework with service users, carers and staff. We continue to implement the restraint reduction strategy, focusing on service user experience and person-centered care. We collaborated with Service User and Carer Council using feedback themes to influence the trust quality improvement agenda. We increased the number of service users being offered the opportunity to participate in research studies through adoption of consent to research initiative. And as you'll appreciate, this is absolutely fundamental for any trust that wants to improve quality collaborating with service users. We hosted an open space event in November of 2019 in partnership with the Service User and Carer Council. And our service users and carers, through this forum, were able to influence and agree our quality priorities for 2020-21. For our third quality priority, which is accessible, we've improved access to services by developing electronic self-referral functionality for patients and carers to the CAMS hub. We strengthened our diversity and inclusion strategy, which the CQC have acknowledged. We increased capacity in PICU, and as I said previously, this has reduced the need for service users to be cared for out of area. We worked with Health and Social Care Commissioners to reduce delays in transfer of care. We also, before the COVID pandemic, piloted video consultations in our community teams, which meant we were ready to roll out massively when the pandemic hit. Our fourth quality priority, recovery focused, we promoted recovery in 1920 by launching a virtual and physical wellbeing academy, providing people with education and learning experiences as a means of supporting personal and social recovery. As you'll appreciate, during the COVID period, we're unable to deliver this in the same way, but I can assure you that we're looking at how we'll do that for the future. I'm also excited to say that we appointed 10 volunteer peer mentors and 5 peer support workers supporting their knowledge and skills development through a bespoke 10-week education program. I'd like to tell you about our achievement for Sequin, which is a framework that is intended to reward genuine ambition and stretch trusts, encouraging a culture of continuous improvement in all providers. I am delighted to confirm we met all our Sequin requirements in 2019-20, including staff flu vaccination, alcohol and tobacco screening and interventions, our 72-hour follow-up post-discharge, our mental health data quality, and use of anxiety disorder specific measures in our improving access to psychological therapies. Finally, I would like to confirm our performance against mental health, national and local access and waiting time standards. Service users have the right to access treatment within a maximum of 18 weeks from referral. During 2019-20, the Trust achieved 94.2% against a target of 92%. 75% of urgent referrals of children and young people with an eating disorder received the first contact in 1 week, and 98.8% of routine referrals received a contact in 4 weeks. 87.7% of people experiencing a first episode of psychosis were treated with a NICE approved care package within 2 weeks against a target of 57%. Our mental health liaison 1 hour, 4 hour and 24-hour targets all performed above the target level of 95%. A key component of the quality process is ensuring that the voice of the service user and their families is heard loud and clear. It's a pleasure to invite my dear colleague Kenny Lang to tell you more.